So we're in the middle of a major urban metropolitan area, Philadelphia, Pennsylvania. Temple University serves Philadelphia and it serves the wider region by way of healthcare.
Yeah.
What comes with being in a major city like this, there's all the urban crises that go along the healthcare spectrum, from homelessness to gun violence to addiction. So while all of those are serious and while all of those are unfortunate, it provides Temple University and the healthcare professionals an opportunity to provide the best-in-class training around trauma that there is in the United States. Can you elaborate on that?
Yeah, absolutely. And that's it's a great topic for us at Temple. It's a great topic in particular. Your book, The Great Skills Gap, gets into a lot of that, of how do we educate today's students to practice in tomorrow's businesses, and how do we adapt tomorrow's businesses to accommodate those students? And so, let me take those three things that you mentioned. Trauma. We have a world-class trauma team led by Dr. Amy Goldberg. We have world-class education out in the community with Scott Charles. I mean, these guys are out there in the streets with their team, walking the walk, talking the talk, and teaching medical students and nursing students and others how to engage in that, how to live that life, and how to work in that. And you move over to our addiction medicine side, from Joe DeRazio in the emergency department, David O'Gurick in family medicine, Breck Chumley in psychiatry, and a whole host of other people working out in the field, street medicine, with our teams, teaching our students the humility and the humanity of working to serve our fellow mankind. I mean, those are important lessons that we're doing. And then we have the social determinants of health. Kathy Reeves from the College of Urban Bioethics, Steve Carson from Population Health. I mean, these guys have teams that are out there, are teaching, are working, are serving the community. Our students of all of our health professions are going to graduate with that knowledge, not only how to treat patients where they are, but how to work together in teams to do those tasks that often seem impossible. I couldn't be more proud of our group as we go out there and we do that kind of learning.